afternoon. My name is Michelle Lane, and I have the prestigious honor of being the Senior Director for Community Health and Wellness here at North Kansas City Hospital Meritas Health. Every 3 years, we complete a community health needs assessment. And one of the identified areas of concern in the Northland and throughout Jackson, Clay, and Platte County is the high number of opioid overdoses. To be preventative, we have written a grant and have access to NARCAN and are doing opioid education and NARCAN distribution throughout our communities. So today we're going to talk about what NARCAN is, a little bit about the data of what we're seeing in our communities, how to administer NARCAN, and some important key takeaways. So let's begin. You may think that this is what somebody with an opioid misuse disorder looks like, but this is who is dying in our communities. Jackson County had 305 deaths in 2022. Clay County had 62 and Platte County had 22. Those numbers have not gone down in 2023. This is our community, and it's the #1 reason for people being seen in the emergency department is whether it's a mental health or behavioral health issue. Opioids are playing a large part in the health of our communities. So we know that we are 13th in the 50 states for the highest mortality rates. The darker the state, the higher the mortality. We had just under 2,200 deaths total in 2022, all from opioid. And these are what is documented. I think it's important to note that documentation is improving over time, but a lot of this data comes from coded data in hospitals. And there are many different ways to code a patient, whether it's upon presentation and it's a loss of consciousness or it's a breathing problem, but ultimately going back and coding these patients as an opioid overdose is something that we are working on to improve. So we know at minimum, this is the number of people who have died in our state from an opioid overdose. We know that opioid overdoses are the #1 reason for deaths in people ages 18 to 44. And we know that 1 out of 3 of these deaths are witnessed by somebody who could have administered NARCAN. 80% of the deaths in Missouri happen in a home. And unfortunately, when somebody shows signs of an overdose, death usually is within about 3 to 4 minutes. 911 calls take 9 to 11 minutes. Our emergency responders and police departments are doing an amazing job, but they're not magical, and it does take time to get to the location. And so that's why it's so important and why North Kansas City Hospital Meritas Health believes that NARCAN should be just like an AED everywhere in the community and available to anybody who needs it. So just a little history. Historically, this is in 2010, we had a heroin epidemic, and in 2022, that all changed. You know, we have had a synthetic opioid problem since, about 15, 20 years, and it's just getting worse. And what we're seeing in our communities a lot of times is fentanyl, and we give fentanyl in the hospital. It is a wonderful drug for pain relief. It traps dopamine in the synaptic gap and masks the pain. But we give a very small amount in a hospital. That little red dot represents the average dose that's prescribed in a hospital setting. And the demonstration here is how much fentanyl is identified in just one pill that's on the street. And so that is the dose that is killing people. We know that just a couple flecks, like that little salt granulation there in the bottom right-hand corner, is all it takes for somebody's brain to send the message that says, you can relax and you don't need to breathe, and causes them to pass away. So here's a picture from a drug bust that was done. And as you can tell, there is no Excel spreadsheet there. This is not an exact science. Things are being mixed. We've all made chocolate chip cookies. We know that some bites of cookie have a lot of chocolate chips and some do not. And so that is why one pill can kill. What we're seeing in our communities is fentanyl is being laced with absolutely everything. Many fake pills are going around, from Adderall to ecstasy to Xanax to Percocet. We've even had patients come through our emergency department that just smoked marijuana, and it too was laced with fentanyl. unbeknownst to them. But after doing toxicology on their blood work, we recognize that fentanyl is in those things that they're smoking too. So we know that, unfortunately, addiction is a complex brain disease. I think that if anybody had good intentions, of course, they would want to break this addictive cycle. And it's really a common misperception that addiction is a choice or a moral problem, that all you have to do is stop, but nothing really could be further from the truth. The brain actually changes with addiction, and it takes a really good deal to get it back into its normal state. So similar to a smoker diagnosed with lung cancer, or a diabetic patient losing their leg from eating too much pie, or a heart failure patient that gets admitted for shortness of air because they've had too much salt. It all comes down to personal choice of how somebody cares for their body and themselves. And these are just people that have made bad choices in taking care of their body. There is a point in the addiction process that people that continue to use don't even get the high that they used to get. That really the only reason that they're using, and this is per people with a misuse disorder, is so they don't go into withdrawal, because withdrawal is a medical emergency. It is a high heart rate, it is nausea, it is vomiting, it is severe pain, and it's just miserable. And that's why many people continue to use, is because the fear of withdrawal it is a legitimate one. So what we're going to talk about now is the reversal agent for an opioid overdose. What you'll have in your kit is a single dose NARCAN, which is a nasal spray. They come in bags that look just like this. Basically, the opioid is blocked in the receptor site, so it can't send the message up to the brain and tell them to relax. This is FDA approved. It's available over the counter. It's $50 if you buy it at CVS or Walmart, but these are free due to a partnership and a grant with the Missouri Institute of Mental Health. You are able to get other doses if you do use this one or give it away. The Clay County Health Department, Platte County Health Department, Kansas City Health Department, all have vending machines in their lobby where you can come in and just take one, no questions asked. Let's go through a little bit of some of the signs that you would see with somebody with an overdose. So you're looking for blue or gray lips. People that have a little bit more melanin in their skin typically look a little bit more gray. Their breathing is usually a gurgling or a snoring. They have tiny pimples. I don't really like eyeballs, so I don't go looking at eyeballs. The big thing you're looking is, are they responding to you, and do they have a rise and a fall of their chest? Are they breathing? Is it normal breathing? Those are usually the big signs that you can see right away. I have administered NARCAN myself in the community at a Quick Trip on Berry Road. I presented at the Quick Trip to go get some hot chocolate, and there was a young gentleman sitting cross-legged by the door, kind of rocking back and forth, and setting, I recognized probably that he was under the influence, but I smiled at him because everybody deserves a smile. And he looked okay, but I went in and got my hot chocolate, and I came back out and he was slumped over and not okay, like not curled up, sleeping, slumped over. It was kind of more filleted out. And so I shook him, and I recognized right away that he wasn't breathing. And in this situation, because I was surrounded by other people that could assist, I got the attention of a construction worker walking across the parking lot and said, "Hey, you, call 911. I think this is an overdose." And then went to my car immediately and got the NARCAN. You want to, if you are by yourself, administer the NARCAN right away, because we know that window is so small, 3 to 4 minutes before they pass away, that we want to get that NARCAN in the system. So it's an easy to administer. It is very simple. It is just a nasal spray. I'll go back to this just to show you. You hold it in your hand. There's 2 of them in the box that you will be given. It looks like this. All of them have an expiration date in the black area on the bottom of the box. They also have a temperature control. They can't be over 101 degrees. So do not leave this in your car in the summertime, but they're so small and they're so lightweight. I just put them in my little fanny pack and I carry with them all the time. But you simply just put your fingers on here and you are going to compress this one little red button. It's a one and done, one dose in this package. You would throw it away. Sometimes people don't respond with just one dose. Sometimes they need 2 doses. And so there are 2 doses in here. It's important to recognize that the half-life of this only works for about 90 minutes. And so in about 90 minutes, the Narcan will wear off and that opioid is still in their system. It doesn't get rid of the opioid. And so they can go back and become unresponsive and not breathe again. And so that is why it is so important that people seek medical attention after you've administered the 1 dose of Narcan. I also think it is so incredibly important to recognize that you cannot hurt somebody by giving them Narcan. If they do not have an opioid in their system, it's not going to do anything. It can't block anything. And so know that you're covered by the Good Samaritan law. And inside the packet that we're providing you, there's information about the Good Samaritan law. This is also important information to talk to, about with young children. There have been instances in the Kansas City area, unfortunately, in situations where people have not called 911 because of fear of underage drinking or drug use in the home and that people would get in trouble. But the Good Samaritan law in the state of Missouri covers people that are trying to act in, effort to save somebody's life. And so there's information about that. So please educate yourself about that. And then we've also included all of the information in this talk in a handout format. And there is another video that we created that's just about how to administer Narcan right here, if you'd like some additional information. This is the same dose that you would use on a toddler or a small child. There is not a separate smaller dose for anybody that's smaller in size or stature whatsoever. So one of the things you want to make sure you do is always remember to call 911. When you administer the Narcan, step out of the way, because unfortunately what happens sometimes is if somebody has had a long-term misuse, they go into withdrawal because you're blocking all the opioid from their system. And so they may start vomiting, or they may be confused, or they may have immediate pain throughout their body. And so in the situation where I gave the person Narcan at Quick Trip, I, administered it and I stepped back and I waited, and 1 dose worked for him. And he took one of the longest, scariest breaths I've ever seen somebody take. But you want to always make sure that if this doesn't work, the Narcan doesn't work, inside your kit, you also can perform CPR on somebody. And in the kit, we have a mask that you can use to protect yourself from exchanging bodily fluids with whoever this patient is. And you can commence CPR because maybe it's low blood sugar, maybe it's a heart attack, maybe it's something else. So that was also inside your packet. We are so appreciative that you are willing to carry Narcan in the community to help protect others. And thank you so much for your time. I do have some information here with my contact information if you have any other questions. And I'm happy to send out my slides individually, but thank you so much.